why incidental is because you are not really trying to find them out. You are trying to see something else, but you find these lesions. And types of lesions, mostly these are benign lesions, because if they are symptomatic, then you are actually trying to find them out, and then they would be aggressive or malignant lesions. And the significance, well, not very significant, because again they've been asymptomatic, but it has been documented that you were screening for a ligament injury, but you got a bone lesion, and it has to be concluded. So you need a full stop to that. And the conclusion would be what would be the end of the topic as a take home message. So in what conditions would you investigate these cricketers? When you have twisting injuries, like you fall down while bowling, you have injury while running, there is chronic pain. Say a fast bowler is complaining of shoulder pain throughout the month in training, and there is no reason for the pain. There is blunt trauma. That means that you are injured during catching in the slips or something like that. So these are the conditions where you would get X-rays or MRIs done to understand if there is any lesion, or any injury that you need to treat, so that the player doesn't miss out on his games. So X-rays, CT scans and MRIs, these are the investigations you do to rule out these injuries. So this is one such scenario, that you have a player who catches in the slips and then he suddenly has chronic pain over his palm. You want to rule out whether he got a fracture or not. So you get his X-ray done and then you see a lesion there. Uh, it looks atypical, it is not a fracture, but everybody starts getting worried that, oh, there is a bone which has a lesion. And in today's time, the radiologist would report it as a neoplastic lesion. So once the word neoplasm or cancer or something like that comes, everybody is worried. But is it worrisome or not? We think as a clinician, something that was not symptomatic, he never complained of pain over there, this lesion must have been there for a very long time. You get the X-ray done, you document it, this is an enchondroma, you did not treat it, the patient will not have symptoms because of this. The pain would have been because of the swelling or the blunt trauma that he got, would go down with anti-inflammatory drugs, and the player would be back to playing. So enchondromas is one such incidental finding that you find. Now this was in the hand because of catching. When you have shoulder injuries, you are ruling out ligament injuries, rotator cuff injuries, or your ACL, PCL injuries. You will find them in the proximal humerus or the distal femur. Very typical findings. You document them and you neglect them. This is, in a way, we call that supervised neglect. You are not treating it, but you are making sure that this is dealt with. Again, you have a player who gets hit with the ball very hard at the near the knee joint, a painful swelling, goes back home, 2 days of rest before the next match. His pain is not subsiding. He wants to meet the doctor. He gets his X-ray done. They see a swelling on the bone. There is a bump on the bone, and again everybody is worried. Oh, there is a bump on the bone. Is this because of the injury? No, this is something which was there since a very long time, maybe since childhood, and these are osteochondromas. So again, these need not be treated because they were asymptomatic for a very long time, and this pain will go away in a couple of days, which was because of the injury. So similarly, you have osteochondromas around the knee joint, around the hip joint, which get screened because of other injuries that you want to rule out, but they can be again kept under supervision. If there is no increase in size over, say, a period of 3 to 6 months, you can forget about it forever. Now you have a laxity in the knee joint. Patient is prone to having, ligamentous instability in the knee joint with the fielding and the bowling regimes that they have. And you get the MRI to make sure there is no injury to the ACL or PCL, and then you see some marrow edema around the proximal tibia, and then your radiologist would say, oh, there is something that you have to deal with. Now these are findings which will get in even a regular person who has no injury. These are just bone islands which again are there since childhood and can be forgotten about. If the pain doesn't go for a very long time, you can just give a supplementation of vitamin and calcium and these symptoms go away. So these are all bone islands which can be seen at different sites based on what is screened. Now this is again, bowler was bowling, fell down on his stride. You got the X-ray done. Again, you are seeing a lesion there. This is a non-ossifying fibroma. No need to panic. You don't even need to biopsy this to confirm what it is. These are very typical findings on radiology and can be neglected in terms of injury or player returning back to sport. So these are again various sites where you can find the same lesion. So these are called touch me not lesions. Do not do anything about these lesions if you find them in your players who are getting investigated for other injuries, the enchondromas, the non-ossifying fibromas, the osteochondromas, and the bone islands. Now there is something that needs treatment, which is again not very problematic, not a cancer, not going to be lethal to life, but lytic lesions in the bone sometimes are asymptomatic because these players are very fit. They are making sure that nutrition is well kept. The pain thresholds are high. Some lytic lesions, when picked up incidentally, could be giant cell tumors. When you get your X-ray and MRI done, you need to do a biopsy and get this treated. This may take the player off the field for some time, but if you treat them early, you save their joints and they get back to normal as if it was just a normal fracture. The rehab and the protocol of returning remains the same. So the approach to an incidentally found lesion on X-ray or MRI while you are investigation or trying to rule out an injury is to know whether this was symptomatic before or not. If it was always asymptomatic, you can observe it. If it was symptomatic, you do further imaging, you may do a biopsy and then treat accordingly. So the take home message would be that most of these are asymptomatic and can be safely observed, doesn't change the way they play their game or they need to rest. If symptomatic, then this is not incidental. It is a way that destiny helps us to find these lesions early so that they are picked up and managed in time. And it is very rare that an incidental finding would need any treatment. So there is nothing to panic if there is an incidental finding in an asymptomatic patient, and they can be back to their sport as soon as possible. Thank you.